Sewa enhyira sei ene wa woda o papa Nana Kobo ene o mame so mama happy birthday Nana Efia sewa enhyira osei o papa Nana Kobo ene o mame wo nyina se o ma happy birthday sanso ena mi editor ho fefo efua mensa ne mame eye ata enti efua mensa ne mame edi ni birthday ne enti happy birthday Auntie Mary enu nuaba Mata Korte debi ifua dia Mary and Korte okay ifua mame Mary eni Mata Korte ene mawoda mo ye twins mo nya 63 years manyi kama ifimuma George, Joanna, and Afi Joshua. Munyina so mamu happy birthday. Enti ene yenia ba ifwa mensa. Ne mame a birthday. Enti ifwa catch your mama say after ene me do mo call lunch. Catch your mama say me den ba call lunch. E wo nyame bi. Yeah. Nyame bi, okay? Yes. You come na tina gate na no pay. You know. Me show boy you na manfo na eni muntra. Ana jojo mbwa. Sada ta honye. Wallahi abochi ye wani ya de wombeko. Okay, any everybody come for kidney ho. Na ye kidney no. Na doctor ba, Dr. Wilfred Baba, maybe sanse kidney ne ye kan de utwi mu ana. Ene ma na kama na yetwi kakra na ya hwe. Na ansa na no tie o. Enyu bi ame de pa is it pa Thomas na bo so nipa ya ade a osayi onipa ya ade a osayi ampa enti obi ya bibi na se so kanfo na bra wote ase enye bu ansa na oba tire book tintintintin enti bi de bia mekoso ka se emi scientific alternative medical hospital de Ghana for ye kwekoto bia ni mu anopa awia anadwo ahomache a ye bompa ya ye nsran kwantintin Enfama Dr. Sheikh Ami Bunsu ene ne hukani hajia ene adwumayefo a ewo Army Scientific de tabe kasa ne se your hospital o madwuma ne so obi yare a oba ona so mo hwe no a wo mu gisika onye fa so ntini edidwa na so Dr. Sheikh Ami Bunsu se dabi enye sika ne nyina wiase bibia dabi enu nti afimu a whole year obetu esika da to UTV ha say UTV fu mu nyi sika we mu beje me se ne ye kire no no san check ni ko yiye ne de beto ho eno se Ghana mamu ha ba bia obi o wapomde hunim de bi obetu de aboama Ghana fa anya pomde ne de asomoman no wo metena se wo sefata no enye obi akeke de wo sefata no ye ma ne kwan metena se na nim de no wo fa mo Ghana entin wo hu anka betumi akasa be mfa misika nhyame ho obi ayare omna na minisika wanya ne sa enti Dr. Sheikh Ami Bunsu de me de bia me kamete ne so a na masore wo se me kan kyese wo anyina achi no ne hospital no so san ye adwuma owo fidi ade hwehwe dipadua no mu se wa poso na ye wo ya wanya kwanhia da wo na mabu obi a stroke achi no awo ho na ye den amaw yare krankro ben na wo ho how they call Army Scientific yanhwe ensa ma wo okoduru ho a wo mu benya bra bisa questions na fie de offer machine mu aye test say nyina ni yehu de di kan bebia yare ne hye empempenso a yare no aduro any damage a akoso wo inside ho no wo mu hu ni nyina wi a no mo agina so ama wo aduro a ene no beko enti ye haba meya ene nubran ya ene abefo de ne aka bom ntini mienu ne ye adwuma wo ye den yare no Allah shafi obeko enti Army Scientific nkrabata bi eben obi antutubiri kana ko sisi a wo de wo yare se den kra no a ko ho na bedi ho adanse wo kina bi ade a chairman sa nyina adu timba bobo mo numbers hwere na ba na fato na fresh sisi a na be bi a eben wo no wo mo kire wa na wakọ akọhwe wo yare wate aye 020 722 9505 020 722 9505 0245 and afe 0245 275 254 0245 275 254 and 0244 227 192 0244 227 192 from na kwahwe ho yare wate bida sinano pay Dr. Wilfred Ba aye Greater Accra Regional Secretary at the Ghana Medical Association a doctor for Kuba time incremental mono etwerefo at the Emma Womo Doc Akwaba Bibia boko de a doctor for one kran nyina ho ye bia ho ye wo jo Doc ye ka kidney ebrofo ni twi ye den
I'm saying, no, better you.
And I mean, document.
I think Breboy, which one? Liver, Anna.
Breboy,
liver. And the kidney need it. Meaning, just a woman.
That's a boy. Okay.
Your friend said,
ye can't kidney, you are bene.
Okay. It kidneys, no, Obia, or most people were kidneys too, me, no. A very important organ in the body. Na e fifi hanum. I'm sure say me sure some be show you.
Be show na ya hwe
na ya hwe
baby kidney ne she.
It e near aha e inside honum. Now most people were two. Only a few people no more one. And it could be because it be a time of sometimes back but most people were two.
Okay.
But the good news ni say obi abetimi surviving on one.
Okay. Into
one cry, it's okay. And nothing I yet me back obi. And kidney transplant. It's the kidneys and yeah, Juma baby. One of them is say
and
yes, and only
okay.
Some baby I shall
okay.
They say bean shape.
I say
Na yeah, Juma baby. One say okay, into in the lab master because and then they produce urine Johnson
and then Maria Johnson
yes and then they produce Johnson now Johnson and yes Johnson keke one it regulates water balance in the body
okay
to be who says so unu misio bebrea u Johnson bebre so unu misio bebrea u ko Johnson ye kitwe bi na bia kala na ye deep what happens ni say so no monsieur say kidneys no na say is the filter in the body.
Osono so. On sonny.
Yes.
And so no so.
Exactly. It's a filter in the not just in so it will come to the rest.
Oh wow.
And so no monsieur baby kidney no be filter na near body no the one that the body needs no. It will maintain that one. Then the near excess no na aba as urine. And you see now unu misio bebre ujun so bebre because nyaka no the body doesn't need it. Pacha what you say. So one no misio so uko jinso na ya kitu
bi. No ka sentinel out sentinel.
Not just say kid afa nya say afa no but nyaka no endorse. It maintains balance in the body.
Okay.
It is a kidney need to mean juma fine. Unu misio bebre Antimi P. It is antimi P. What will happen? It will have to find places to go to. Ti anuna etimi ko unaimu o sam o yefuna ye kese because insun antimi P. Pacho what you say? I want to explain everything today.
So I say ya John so be senko. E san say o kidney to me insun no. Enso na ka system no mu. It now only say ensure there wherever it is, it has to find space. So obie dams is here. The water will have to find space. We know I didn't son go is
a filter then it comes through that tube. It won't tube na every sabi she we know and if no ureter it be fa ho no na back down. Abada obia we shut down then the bladder abegu ho say ujus na agu ho no then from there na afa we mu aba
obama mu na aba
mbacho what you say so ye baso or baso na afa ho no enti se o kidney ntimi nya djuma fine na It's on anti-mimpi. It's not just say it has to find places. To be honest, we na attack.
No.
Now, be honest, on sa na attack. We near chi na. It me person me explain baby. Aha. Then number 2, waste products from the body. Waste products.
So why no who say bolamai?
Oh yeah, it's like the filter in the body.
And then the juma so.
Very, very important. Anything that will keep in your juma a serious thing. It waste so udidio unum insure unum a draw. The body breaks them down. The liver and kidney and other things, they break them down. The good parts, the body takes. Waste product, it has to come out. So it comes as phases. Other things, the kidney remove them. They all come through the urine. They break them down. Into your waste products. Into the kidney, if it's functioning well, it has to remove all those waste products out. It is our kidney in here, Juma fine now. What happens? All the waste products will be in the body. Into a car body, then it makes you start feeling sick. If you're not feeling sick, now why you're weak, then you feel like vomiting. To some of the waste products, like urea, your kidney, they find urea creatinine. That urea, no, causing uremic gastritis. They say ulcer. A call heart around your heart, uremic pericarditis. To me, call the brain. Now I am confused. To me, cause it the toxins now body it makes you feel like vomiting.
Why restless?
Very good. You see, the kidney is very important.
I see.
And now I am coming down because I want people to understand.
Yes.
Today I'm not here as Greater Accra Regional Secretary. I'm here as a kidney specialist.
That's
wonderful. My area.
Yeah, Papa. Now, now can be answered. What do I benefit kidney?
Yes. Into my functions.
Functions. Okay.
The next thing is it regulates our blood pressure. It produces some hormones. Back when you're feeling rainy, they regulate your blood pressure. It's a kid is near Juma fine now. It may cause hypertension. You're feeling secondary hypertension.
Hey.
But what I see? It is a young person, if you are 25 years. Now, banana BP or high. One of the things we look for is kidney disease. Although hypertension can cause kidney disease can also cause hypertension. And I produce another hormone, erythropoietin. And no stimulated bone marrow, no, say, chicken, bone, no, middle, no, say brown, bone marrow. That hormone is the one that stimulates the bone marrow to produce the red blood cells. It is our kid in near Juma. What do you think will happen?
Yes, I want to be Nyamuja.
Nyamuja. It will say, Omoja no ever form. But what I say. And there are a number of other things, I think, because of time. It Yarea happy with kidney disease. There were 2 main categories. You have an acute kidney injury, and I find chronic kidney disease. We'll come to the chronic. The acute, anything that can happen, like your heart, the blood that your heart pumps, about 25% of it goes to your kidney. Every other part shares the rest. It is very important.
Wow.
It's anything that will reduce your volume, your kidneys can kidney volume, it can shut down temporarily. It is you have diarrhea, vomiting, and you are not drinking water, you are not replacing it. I told you the kidney is the filter, it's very sensitive. It will shut down. If you're not acute, and we can reverse it back to normal. It's not every kidney disease. You say that is chronic, most of them we can do something about it. If you're not acute, and not say if pregnant, now or bleeding baby, and then you don't replace blood or the volume, the kidneys can shut down temporarily, and then if you go to hospital, we can reverse it. And when you have a chronic kidney disease, and chronic, not just we cannot reverse it back to normal. That one means the damage has gone beyond repair. So what we can do is to try and slow down what we call progression to end stage. There was stages 1 to 5. 5 in the end stage. A group 5, as I said, your kidney cannot support you anymore. All the functions now, you said you filtering, excreting the waste, so then we have to now come in and support. through dialysis and not kidney transplant. Pacho what you say. Now chronic kidney disease, no, the main causes, hypertension, any diabetes worldwide. So what BP and now a now one thing controlling the year, it can affect your kidneys. It puts pressure on your kidneys. There are other things that also cause chronic kidney disease, like drugs. Those who abuse a lot of these painkillers, they say brufen, diclofenac, naproxen, all the fen. They can, if you, I'm not saying that we shouldn't take them, but you take them for short period. But obi wawa, if you are juma now, instead of resting, or person of a painkiller, it is not a good thing. You don't have to abuse. Obi wawa. Every month, or diclofenac 10 days because of menstrual pains. It's not. There are other painkillers are good for kidneys. Okay. Abusing those things can do. The next is herbal medications. People are consuming a lot of herbal medications, and we are seeing now. Sometimes you see young people, they come, they don't have any hypertension. They don't have diabetes. They don't have any disease, but they come with kidney disease. And most of when you go into the history, herbal medications, it is one of the causes of kidney disease that we want people to know. Don't be going and be consuming herbal medicine.
Herbal medicine in the enye and now say,
Maka orthodox, I say diclofenac. I know you see if you abuse them, you can have kidney. Okay. Herbal one. Most of the people, they go places, they say, "Kono 1 gallon." Nobody tells you about those. Into anything, see, I told the kidney, everything you do goes there. If you put too much stress on it, you will damage it.
Now, you show one more swa. Chubby.
Yes. Me bahonum. Then, yes, alcohol, this smoking, they are all risk factors for kidney disease. If you drink alcohol, you smoke, your risk of getting hypertension, need diabetes, is very high. Now, worldwide, hypertension and diabetes, if it's not controlled, the risk of kidney disease is also high. You cut down or you stop. Then, infections. Sometimes you can have infections that can affect the kidney, severe infections. Urine tract infection. Now you don't treat it well, it can affect your kidney. Throat infection, one treating it, especially in children. As they grow up, it can affect the kidneys. And you want never obstruct. Say that you picture no. Say tubes be connected from kidney into the bladder. Say a block here. Now urine into mean flow. The urine can damage the kidney. It is a prostate, enlarged prostate. Now a Johnson flow. Now it is always upper. It can affect the kidneys. And also anything that can block it. So those are some of the causes. There were other systemic diseases and also to me cause kidney disease.
Obinya kidney disease, say bia, obinya malaria, who symptoms. Kidney, so say, we are kidney, unya, or how, and I say, when your kidney infection, and I say, when your problem, send when
very good question. Inti, send your Mikaya, oh, Yamikan say, inti, Santimia, but who said, na, unesa at that time, Unima Hunu, Anabibi. But the thing is that most of the time, the early stage, if it's chronic kidney disease, early stage is maybe stage 1, stage 2, stage 3, you won't feel anything. Then stage 4, then stage 5, then you start feeling all these things. That is why it is important, say, you go and screen for your kidneys every year. Just doing a urine test alone can save your kidneys.
Yes.
Every year. At least once in the year.
How many years in what that ben on check it that when you are 44 years?
It's important because most of the time you won't feel any symptom. But when it gets to the end stage and I'm very severe, then you can have swelling of the body. Maybe say so you feel weak, dizzy, you feel like vomiting. Maybe I will BP across they try and you still can't come down. There are so many other things. It depends if your potassium is very high. It can cause what we call arrhythmias. There are so many other things. But don't wait for symptoms because by the time our symptoms never not just
say too late.
I too late.
Aye. And come here din na enra de no ene na de nyina ya de ho hia enra na ye glaucoma enra ye hu ani de said ya they say the whole of Africa sa glaucoma yare and Ghana ye ha na wo pa na the whole world so glaucoma Ghana yare to so tu enra ye discuss wa no na e ni brese na ye de kidney so ama for the message ya ba pa na omo so mi ahwe bright bright links rex payback bright me few na few ochina ana me Juliana agon Julie Enfiobia make body no kidney no me body din asane asore am obi on say me kidney twi pa ma ye twi so many years ti me kidney twi me bopa na doc ye hwe kidney ye kan wasem ye fa ne se bia obi anya yare ni bi ye treat man ye
yes into the good thing is say okay, acute one no your kidney can go back to normal if you come to hospital early.
Okay.
You can, that one is reversible. Chronic one also yet me ya home baby. Say a chronic what we have to do is say we have to stop it progressing to end stage very fast. Until you want nyama controlling your blood pressure. So what sugar we control the blood sugar. In what infection we treat the infection. Some people can start from stage 1, stage 2. It can take them 10 years, 15 years, 20 years to get to end stage. And that is what we are looking for. But if it gets to the end stage, then you either do dialysis and a kidney transplant is the treatment.
Okay.
So you get transplant now and let's just say you are cured.
Okay.
The only thing you do is to be taking medicines to make sure that your body doesn't reject the kidney. And we can do kidney transplant and you are fine.
Obi maybe some for so message the amount kakra ba me di can be some me dey wi.
Okay.
Wi na fa bi some sankrofon so dey the amount kakra. Yeah kan why o say yare bi wo ho a e betumi aka say asebesi u betumi anya bi. We share group of people u betumi anya, share group of we betumi anya, share we betumi some people are prone to some diseases. Kidney so no why na you prone to kidney disease?
Okay. All right, thank you. I mean so almost everybody is at risk, but those who are high risk at one, so who have family history, maybe will be obesity, maybe will have kidney disease, then your risk is also high because there was there are some genetic diseases that can run through families. One of them, you find polycystic kidney disease. It can be other people can have it, but once we see it early, there are things we do to minimize the risk. So obi wo obusa no kidney disease. Now obi our hypertension and diabetes, which is not well controlled, they are also at increased risk of having kidney disease. And what nipem busa we tell them they have what we call connective tissue diseases. And then a big into me can, but they are also at risk. And if you are pregnant, the pregnant women who have they develop hypertension in pregnancy, they are also at risk.
Oh. Oba na nyem na onya hypertension ni nse ni mu.
You find pre-eclampsia, near eclampsia no. Unya no your risk is also high.
Na ya kan kidney no edos organ.
Kidney disease. So first those times elderly people no but these days we are seeing young people.
Young people why I didn't about from now young people
and then say those days ubenya hypertension and maybe 50 60 70. But these days there because of affluence now see because for the KFC ni fried rice ni those days say contemporary when I did village. Because of lifestyle change, most people are getting hypertension diabetes at younger ages. And like I said, those are risk factors. But we're also thinking that sometimes the herbal things and the infections that are not controlled are also contributing to why we are seeing the increase, and especially in younger people. And the aphrodisiacs, because it's a lot of mixture, alcohol, herbs, nyama bebre, and like I told you, anything you take, most of them will pass through your kidneys. So once you do that a lot, it can damage your kidneys. Your kidneys are very, very important.
My miss a question we Moby. Or say me din the loud mouth, I always urinate so fast when I take in water. Please, I want to ask if it is also a kidney problem.
Okay, it depends. If I drink all this water right now, maybe in 30 minutes I will want to wee. There's nothing wrong with that.
Na ya fa say bia manum we be 2 3 anajo. Na de akoda. Masoranyo so e bia me da be 12 1. Be 12 and 1. Masoranyo so me soro be many say me be 5 o'clock and I'm go so ye. E no so e.
Any problem?
Any problem?
Any problem at all?
No.
But say who say so intense more than normal. Then you have to go to the hospital. And not just a kidney disease, but even diabetes can cause that.
Okay.
To make you. And all infection or urinary tract that you can urinate frequently.
Okay. 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 Me da se yen hwe we obi say nana kwame o say mi say ebede no obi etumi agina jonso so hu say wanya kidney yare ni bi.
Betumi agina
bia kidney jonso no so. Or say how does urine identify that you have kidney problem?
Okay, it won't mean share with urine, like I said, because urine is
I say bet you some Johnson color ni red kakrani.
Okay, there are if Johnson color red, there are different things that can cause that. Sometimes medications that you take can make your urine do that. And now if you are dehydrated, it can become brown. There are some like hemolysis. When you have malaria, it breaks down your blood cells. It can become dark. But generally, you can't just look. Well, there are a few conditions. We can look at the urine and say, oh, there may be a problem. But let me just say, because I'm talking to the public, you don't just look at it and say I have kidney disease. Rather, you can send it for test. Just by doing a normal urine test, like 15 cedi, we can have a lot of clues from it.
Maybe urine test, 15 cedis.
Oh, look at public hospitals, anybody yedi.
Any
urine test, anybody yedi. And look at our health insurance.
The cameraman may money deal.
Our health insurance.
I was so.
Oh yes, call government hospital. You can do it. Just start with a urine test. Because there are things we can see in it. And we can put in measures to stop kidney disease.
Doc, someone can nano pay. Ghana for your pet hospital check up test.
You're trying to say time we are answering. But at least once a year, kita 100 cedi, you can do all these things. Urine test, then you B creatinine. You check your cholesterol.
The whole year, no. Na me 100 cedis.
I mean, at least a few. So yeah, BBA there, 500. You can do maybe now I ECG. Now, just a few things. Then you know for the whole year. That if there's anything, maybe cholesterol or so. Dr. Abema will draw. And now maybe I will BP. You know who say call we are now I catch say way so that unya hypertension. It is important. Senya, ukano. Say yeah, all the cost service. Which one ma essence and all cost service. Uko ebe catch your Twitter. You can so every 3 months ana 500 kilo fabra. They are not saying say ana fabra, but they say this kilo because then the body works more than your car. So why won't you do checks on your body?
Rosemond Oduma was say Ota Johnson papa into an ajube prince and was sorry.
Or Oba. Also Ojon Sopa and Ajo. Yes. If you anajo Ujunso more than 2 or 3 times, it's not normal. You have to see your doctor. There are other things, there are different things that can cause that. And not just kidney disease, but there are other things that can cause that. Your doctor will investigate it.
Obisa, I don't know whether it relates to kidney problems. Sometimes I feel like something in my abdomen is moving. It scares me. Also, been am nayasi.
And they just call hospital. Yes, can nayasi.
Doc, and come on, you didn't know pay no. Minimum say nipa do draw no adwene nkoso. But me wo kan no me to di me tie dia wo kan na me dwene ko akiri ye pa ewo ayu. Obi se omia ne hana so omia ne hana no ye ne ya. Na ne kidney yare or kidney problem yampa.
Okay, so usually so what kidney problem unfili ya obia.
Unti pains wo.
Yes, so what pains is likely so when I will either infection or urinary tract, which is treatable.
Okay.
And now so what kidney stones. Stones. Sometimes you can have stones in the kidney or the ureter, and so you can feel pain here. All of them are treatable. No just with kidney and juma. Just something there we can treat it.
Na ya kan nyina no nipa dodo no a enfa mo adwene enkoso yemfa say akwada ketua ya wo no so betumi anya bi.
Yeah, very important question. True. We have children, babies. Some of them are maybe what we call congenital. It is abia or time or womb no kidneys now develop fine na you wuna obenya problem. Ebi mu fo ya omo wo emema mo wo nya efe no posterior urethral valve. Baby a junso no free ban. Bibia block ho no. Nti ye wuna ontimi njunso. Ti gise ya ko ye di nya efe no stent bibi na ya ko bie sa we no. Ti se wa hu ntem na wa nya na by the time we ba no na kidney na say. And na your infections throat. Some of these strep throat infection one treating here. Until we have children, even children on dialysis.
Enti me bo. What kind of infection? Many throat infection which one can be kidney.
One treating
a year. Enti yemfa say STDs, STIs, sexual transmitted disease and infections in nyina.
And also one treating here, it may affect your kidneys.
Wow.
But what treating and I can say most of these nobody should get scared. These things, so won't be just go to hospital. Your doctor will sort you out. When I say yeah, but I mean, don't get scared. Nobody should get scared.
Maybe I see a book who can
nobody should get scared. That is why this year your team is bridging the knowledge gap. Sometimes but you have a lot of power, you have a lot of control. But what I say, so nobody should get scared. Like I said, let's just check. At least just tell your doctor I want to check for my kidneys. They'll do it for you. And you may not have to do it. Just once a year is okay.
I'm for a gone Juliana or say me miss out say hepatitis A, B, C, any kidney. It would be dangerous pa and anyone should come nipa.
Oh, when it there on to me cancer obi betting me anya hepatitis B. Because cancer. Ebimusu or hepatitis and cause the whole of his life. Okay. I don't think we should say which one is more than every Arabian way. Hey.
Okay. Ha. And now no pay ye din komo pa na me ko kan say kidney ni twi din no be hwe amanfo. Ha. Wa onim ni fabra na hwe. Na na puku kofi puku da ko o de ne de aba. E na afei ye nyina so ne esua de so ho ha ye nyina so ne esua ne na ba ko bi so wa ha ne de o kan se mi nimu no mi wi a me ne no ofi ha poku bi smack so ne de aba na de tititi sa enti doc afi ene eye da motu de si wa mo de ehwe o mamanya okay also please my wife can urinate 2 to 3 times in the night and it scared me ampa
2 to 3 times. I mean 2 times is okay. But say it depends. Uko that now one 2 bottles by all means you wake up and but if he's getting worried that you should just see a doctor. Okay. No your checks. Yeah.
Yes, sister, no na no so want to wa kuhunu doctor.
Yes.
Until wo dwon so na hunu yi a kuhunu doctor we enya sem bia na eno Obi say, please, the government should come to the aid of the kidney disease because dialysis is very costly.
Yes.
Even during the dialysis, you have to buy blood. If you don't have money, you can't go to dialysis. So you have to die.
In fact, we have to come there. Treatment, no say American, but just say dialysis, no, it's an artificial kidney machine. Okay, machine with artificial kidney. What the kidney is not able to, some of the work that is not able to do, no. When you go on dialysis, no, it's like me can say all the toxins, extra fluid, no, our body, no. You go, then it will take the blood from you. I'm sure they will show us the picture. it get into the machine, the artificial kidney. A better kidney. A better excess water. A better way. A better waste product. It's say a rule mojano. Then a you are the same clean blood no. Now samba back to you. That is what you do, and you have to do it 3 times a week.
Yes, in the morning.
The boy day. Be 3.
And na edin komo kid na ye kan ho asemi. Ebinom de aba pa Gilbert apawu o se ye frɛ no ahrawa. Gilbert de aba o se ye frɛ no ahrawa. Na abena asantewa o se ye frɛ no osa anase saabo.
I think so.
And nasco fufu so say kidney a friend was sa.
Yeah.
And yi baku bi di ba ha. Na the kind said minimum no. Or no me say me china pa. Obi hu pa.
I think sa no should be.
Aha. A friend no asabo osa.
Yeah.
Ha, osa. And a friend a kidney friend osa. Opoku Bismarck say your friend ahrawa. Bismarck opoku say your friend ahrawa o sa. Doc, it's a foot over na remember it's a world kidney day.
And then world kidney day.
Then am oye.
Yeah. Then there you Kumasi. Nkofo nya wo ho no.
Okay.
We are doing a public lecture talking about kidney disease. Her Royal Highness wo ho no 2-4 years wo ho. Okay. Dr. Insian Saremu. Any regional minister omunya wo honum. We are also doing screening, free screening in Kumasi. This year we are in Kumasi, but we are also here in other regions. So we are doing education. What we want to say that we have to prevent kidney disease can be prevented.
Maybe sir.
Can be prevented. We have to.
Drink
one of the
water.
things to make sure you hydrate yourself well. Say you make kidney air filter. So filter baby we na you don't pour a lot of water, death will be there. When you drink a lot of water, it cleanses your body. Okay. About this is 500, about 6 of these every day.
Oui.
Yes. Unum way.
Special eyes.
6. Sachet water. What you mean? 5, 6 a day. It's very good.
Now, you say so no crown no. Okay. You first also me no 6 and then before we guna man no 10 minutes time no
I'm talking about the whole day.
The whole day.
That's how you'll be urinating plenty.
Okay.
Secondly, no, let us not abuse medications. Say, Doctor Antromawa, don't go and be buying. Obi wa say Doctor try Droman once. The next time, whether it is needed or not. Antibiotics, ni herbal medication. Let us not abuse them.
Okay.
If you have any infection, see your doctor. So what BP? Bomodiana, make sure say you take your medicines well. That your BP will be controlled. Less than 140, the top no. Any sugar well controlled. We can prevent kidney disease.
Doctor Nano Pia that's papa. Ablade efie kuma or say good morning, Eja Kwabena. You and Doctor Madam was say nano paper. No say as some kind 9-5 we them so Ablade efie kuma say I don't Ablade we saw them anywhere. Or say hepatitis B and one it to be 2 as a kora na say manage.
Oh, yetimi it depends on the stage you come with.
Okay. It's a contem na wo show na ho to me ento. Dr. Winfred Ba a Greater Accra Regional Secretary or your experts or your specialist e wo kidney e ho wa ben papa enti ena no pay woni yen ebedi nkomo na ke ne Abigail Ashil kra abedi nkomo ofie ha onya bi enu aba no ko wie na so de adoma Dr. Kahubi ama ne abi namo a wo kokole bumpo akokoye adoi ena no pay enti menfa ni agro esan se ka wa hu den ni pane yafu ahye edu ba bia enti na nka ne yese ya bonu dua de bia na nyedua boda ne kidney no e na sei ne saa no e na sei hye akiri ha eno na sei tintumi nso ne nso no so ama efia e wo su no mu no emese nko wadua ne a wodie nyina na nura fufu ya medi ye say esi kidney na ekoso na so na de aka na ye agyanan nimu da me ka se yesi nika bi wo yefuru no eyamo na aduane na fa na agyanan so afa say kidney na eni nyina nti no aduane ye di nso no se aduane enye papa no so betu ma kidney problems so
not not directly but say it can cause hypertension and diabetes that will
no so dia but e dan a e ba metu ma but me pa so dia di nso no na wa hwe ni pa nti e beda wase I will charge my battery, don't worry. And see, charge your battery with specialized in so abri bia numbi. Me no pa also numbi. Abri bia na beboa am otumi enya ho. This doctor but that was sipi na no pay. Say wo buy and e be twetwe enkomo. Mumie nyina mo nsema doctor say wa buy and no pay na wa beboa me hu kidney ho ensem. Wo sa we butumi a friend sa e dance papa. Nana Joy, you don't normally drink water, then drink water at least six of this special ice and also nanom sachet mudi and also special ice no makoma ko be 6 de bia bo say 10 bia no we are fresh na mama ye dey say mo aja doctor kwan no near the accident so ma Armin Scientific Herbal and Alternative Medical Hospital say womo soda roma womo afasa health segment ho ka o UTV so abri bia ye ne apomdimu abenfo edi nkomo nti enne asere bia obabi a na ye de ama Armin Scientific o se me kan cho say yare bia ye krankro bia abra ne ho na wo de machines to say ba ku bi ono mo se mo ye krampo no e say ayi wo mo ye homeopathy naturopathy reflexology physiotherapy and many more baby wa awo ho aye den ama and just say yare bia stroke na chi wo obi wa bo wa che ko Armin Scientific ho beto obi abri bia na o yare so ntiapo nti saa okọ Armin Scientific a wo mehwew ahwehwe nipadua no mahwe mogye no text bi so obi on be yama na ho so tumi ato wate enti tutubiri komo nkrobata tamale ho boriga sunyan kumase koforodua Accra ashaman emia hodo bebiri na mo no fa number no na ko hwe ho yare number si na didi so yi eye 020 722 9505 020 722 9505 and afi 0245 275 254 0245 275 254 and 0244 227 192 0244 227 192 Armin Scientific na o say Allah we shafi nyankopon wono ene yaresafo nti yebeda mase na yaja doctor kwan ama no akọ ansa meda doctor kwan no rarafo nyina mi chia mu nyina jojo ajare so so mekan so chia mu nyina na mmom enne eye na hita akosia sare we administrator ema open web ICT a bass band radio what taifa enne wa wodentin jojo ene rarafo nyina se oma happy birthday nti yetwa ho ba enne koma ebedie no I say Ghana medical students are Ukraine no ye do omko Granada ho na sisi omko kusuon ma de na police for na ya che omo ni minu ebo omutui ene ho samsam eno nso ye bedi ho enkomo afei deputy speaker of parliament say speaker ni ho a wono kwotena dwamu chair parliament supreme court say deputy speaker no eti adwamu a obetumi ato aba as a parliamentarian and at the same time speaker of parliament nti sa ruling akoso minority say enkoyi sama do miensan na ebedi hu komo ene kwaku baba Jennifer baba Desmond so baba na edi komo nti moma yentwan ho na me nko wie me special IC na so numbi eba ebedi komo etwan ho aba